All right, we've since re-established connection with Dr. Khan, who is a medical expert and as well as the producer of a documentary that he titled Behind the Front Lines, which highlights the issues and the challenges faced by frontline workers amid this pandemic. Dr. Khan, welcome back. I hope you can hear me clearly now.
Much better.
Much better, yes. You began your research for the documentary in 2018. Please take us through what putting this documentary together entailed.
So it entailed, in 2018, as you mentioned, me putting the call out there for healthcare professionals around the country to share their stories with me. And initially, I didn't have the full idea of a documentary. I wanted to collect stories of healthcare professionals in much a similar way to the Humans of New York project, and just share their experiences, our experiences with ourselves, but also with the general public. And I put the call out there, and I got 60 plus responses in a relatively short period of time. And I was quite shocked by what I saw. Issues of racial and gender discrimination, bullying, abuse, rising mental health problems, always with the theme of really tough working conditions. And I felt that I wanted to tell this narrative. I wanted to have a conversation about this with ourselves as a medical community, but also with the general public, ultimately with the view to transformation.
Dr. Khan, why do you think these issues are not openly spoken about? I mean, what's with this veil of secrecy?
There is a veil of secrecy, and I can attest to that in the run-up to the documentary. I had great difficulty to get people to come forward. People were mentioned that they have a fear of reprisal, a fear of actions taken against them should they be seen as somebody that's a troublemaker. And many had, still have career aspirations. So for them to rock the boat while they are still in training, it might jeopardize their future chances of employment. And overall, there's a culture in medicine to not talk about these issues, to not openly and frankly have these discussions. And it's one of the notions that we challenge is that, no, we do want to speak about this. We want to have these conversations because there are devastating effects to the healthcare worker, but as well as to the health system if we continue on without doing so.
And having said that, Dr. Khan, what has Behind the Front Line revealed about, our state of the healthcare system in South Africa and how it operates?
The focus of the documentary was to draw the link between having a dysfunctional health system and a toxic health workplace that results into internalized effects of the system on the healthcare worker, which could lead to things like burnout, rising mental health challenges, absenteeism, people leaving elsewhere, overseas or outside of the clinical sphere, which then naturally puts a strain on the health system, because now you have reduced health work complement and leads to things like increased waiting times, medical errors, and overall reduced health service delivery for the people of the country. And if you follow that continuum, we say that this is actually the focus of the documentary. That yes, there are internalized effects to the individual healthcare worker, but more importantly for the general public, there's actual real challenges and concerns for the health system at large. And that's why this documentary is aimed for the general public. We think of this issue as a social determinant of health. Okay. And we believe that there are overall toxic effects to the health system.
Okay. Just before I let you go, Dr. Khan, what are the solutions to the issues of bullying, discrimination, racism, and mental health problems, which you highlight in the documentary?
Leadership, discourse. We want engagement from the higher structures to acknowledge, first of all, that there are issues, okay. To have a commitment to change. And then ultimately, if you look at other examples from international literature, is to have policies and regulations in place, oversight committees, that these solutions are not just lip service, that they are there, that they are monitored and
Okay, all right. Great chatting to you, Dr. Khan, and thank you so much for talking to us this morning.
Thank you. Thanks for the opportunity.
All right. That was Dr. Adil Khan. He's the producer of the documentary Behind the Frontline, which investigates the toxicities in the healthcare workplace and explores themes of bullying, discrimination, challenging working conditions, and as well as mental health problems.